Dear viewers, welcome to today's format visit. At this point, again, my heartfelt thanks for your kind, but also informative and inquiring letters. Today's visit program deals with 2 or 3 topics, where I felt that it might also be worth discussing with each other. The first is a request from Oliver, and he asks me, how do you assess and what is a plasma rich in platelets? I would very much like to answer this question. Because I have been dealing with it for years, because I was on my way to integrate a stem cell activating method. Into any form, as I was more concerned with diabetes in children. The plasma rich in platelets is a form, which is ultimately reserved for an injection, where you have to go to the place of occurrence. For me, this is more difficult to use in children who develop diabetes. I believe that the large stem cell therapy is the more honest alternative, but at this point, it has been a very innovative development. Which enables us to treat defective healing or wound healing disorders quite quickly, with everything that is needed. You just have to know that the typical components of a blood, one is the plasma, these are the liquid components, but the other are the solid ones. And the normal blood, the main component of the blood, is 93% of the red ones. These are the red blood cells, which of course, as you all know, have the task of supplying the cells with oxygen in rapid speed. They refuel in the lungs, are then passed on to the heart, and are then distributed over the entire bloodstream. And this is a very rapid process, which is why the high proportion of 93%. By the way, the erythrocytes were never included in the calculation for circulation disorders. Today, the circulation problem is understood exclusively as atherosclerotic, and of course also in the danger of clumping the blood platelets through the thrombocytes. And these blood platelets are actually about 1% in normal blood, or 6%, to be more precise, 1% the white blood platelets. The blood platelets are actually quite inactive. But they are the ones that are available when there is a defect healing. That means, at the moment when the cell wall experiences an inflammation, we are talking here about oxidative stress on the cell walls. That means that the red blood cells take over, or then, for example, the free radicals change the cell wall, because they also need an electron very strongly. And this defect healing, this damage to the wall, of course, has to be compensated immediately. And that's where the thrombocytes are usually responsible for. On the other hand, of course, we need our blood cells for wound healing. So, if we have a wound somewhere, if we have a fracture or an abrasion, then these are completely normal processes, which then focus on this process within the framework of their own blood clotting, and only concentrate there, so that the blood cells are very quickly concerned that the wound can close, stops bleeding and then, of course, also practices a protective function again. The fact that these blood cells also have a healing effect is due to the fact that they themselves are carriers of very interesting protein structures in our body. And while the blood cells in the primary blood only have 5 to 6%, now, through a special centrifugation, and that is actually the effect of this application, that per, let's say, applied test, now the proportion of blood cells against which the erythrocyte is exchanged and the new, let's say, concentrate contains 94% of blood cells and thus, of course, also a dramatic increase in so-called growth factors which contain the blood cells. And that is something that can of course be exploited. It can be exploited in the moment that, for example, we are talking about keratinocytes that stimulate keratin synthesis. We are talking about interleukin-8 vascular endothelial growth factors. It is always about improving a defect healing. Insulin-like growth factors 1 and 2, the list is quite large, binding tissue growth factors, the fibroblasts, the connective tissue cells are activated, and so on and so on. That means that in the moment, for example, there is a tooth extraction, I can actually locate this gel-like platelet-rich plasma right there. And the whole tissue that now has to grow up from below can compensate for this defect in a much faster way. And of course that goes much further. Its first big push was, of course, this platelet-rich plasma in the cosmetics industry. To simply tighten the worn-out tissue and fill it up with voluminous tissue. But that's not my part. I don't even want to talk about that now. For me it was interesting to see what I can do. For example, here in the context of an epicondylitis, a painful elbow inflammation, can it have a positive impact on the inflammation process? Can it have a very positive impact? For example, it can also help in a knee arthrosis. In a knee arthrosis, inflammation processes occur through the removal of cartilaginous tissue. In the context of fascia therapy, if I locate it exactly there and do an intra-articular injection with this plasma, I can improve a process. Of course, if I have previously excluded another inflammation. But I can improve this defect healing in the context of all the foot diseases, the diabetic foot, the ulcus, the foot ulcer, even wound healing disorders, even with diabetics. At this point, when we talk about the diabetic foot, for 30 years I have been an expert in the context of UVB, ultraviolet radiation of blood, HOT, the enrichment of blood with oxygen. And I have observed incredible processes, especially in the context of late consequences of insulin therapy with diabetics, in order to recognize all these things in the long term and not to let them arise at all. My UVB patients no longer went to the laser of the eyes. And they only came once a month for this treatment after a more intensified treatment in the beginning. That means, there the platelet-rich plasma does not attack. This is prophylaxis. But if a diabetic foot is present now, then I can, through such measures, significantly contribute to rebuilding the tissue here more rapidly. Of course, integrated into an improvement of oxygen supply on this peripheral level. Dentistry, surgery, parodontitis, parodontosis. Of course, in the context of recognizing which causes are behind the parodontosis. But before the teeth loosen and the tissue forms again. I can improve local processes through this platelet-rich plasma in all the implantology of the dental implants. And there are a lot of problems with genital fistula, for example, also with genital prolapse. Or also in the context of plastic surgery, there are a lot of indications. And you are simply well advised if you first of all in a consultation, also in ophthalmology, dermatology, neurosurgery, in the case of DSIC damage. There is already a great deal of experience in the application of platelet-rich plasma. And, of course, everyone is indication-based to work with this application on their own way of experience. It is not foreign blood. It is not embryonic plasma cells. It is really made from our own blood. And for me, a very valuable addition in the context of our own, let's say, possibilities at the moment to stabilize processes, to support. And I think especially in the context of hip arthrosis and knee arthrosis, as we observe it from our point of view at the moment, a very valuable and very helpful therapeutic application, if you are perhaps a little bit informed about these things now. That's one thing. The other thing I actually want to tell you at this point is that the problem of nanoparticles has been incredibly important to me in recent times. And today we all have a burden, we humans. I am the generation of 1959. That means we have forced this expansive development with all the plastic ourselves today. We are involved in this development. I don't know, it's not clear. We are involved in it, but I don't think any of us has ever been able to foresee these effects themselves. And today we have to deal with a big and really serious problem also in human health. This removal of the plastic has led to the fact that, of course, the whole thing leads back to us humans. And that is the normal cycle of the world. We are also responsible for this. So we will also be able to feel these things on our own today as part of the food chain. It works, and it couldn't have gone well either. But the dimension that has arisen as a result of this, to actually conserve this waste on our Earth. Because, of course, it has breakdown times over years, decades, and centuries. And it plays a very big role, especially with plastic. I think it has to stop that we're just talking about it, but we all, you, me, we are challenged, because we can hardly eliminate it from ourselves. And the body has no plan for this. It's pretty overwhelmed with detoxification capacity today. It starts today, of course, with much longer expansion times than the generation like us, if you have an age beyond the 60s. That means children grow up with this thing very early today. And I think of all the plastic toys made in China. Plastic toys rich in phthalates, rich in softener. Everything that has to do with plastic and liquid, of course, releases these xenohormones. And xenohormones don't move in our body like toxins, but they occupy estrogen receptors. And of course, this leads to the development of estrogen dominance. Today we see increases in estrogen or hormone-active tumors, mammary, prostate and colon carcinomas. I'm just giving you this again because it's very burdensome for me. We ourselves can also excrete nanoparticles through inospheresis, but I don't want to do that at all. And it's not even possible for all of us to do that. But I just want to say that 50,000 to 60,000 sea dogs die every year. Also with all this garbage that we throw into the sea. And today, Eskimos, of course, have the same civilizational diseases as Western European countries. It is known that about 260 species of animals cannot recognize all this garbage as foreign at all at the moment. And so they catch themselves in this garbage and eat this garbage. And so, of course, they are very quiet, but they also constantly say goodbye to certain species of animals, because they cannot compensate for this as part of their equipment of a natural, healthy metabolism. And they are dependent on nature to give them a habitat that they use, that gives them this naturalness. And we are on a great path that we, of course, through this plastic floating material in the seas, on which also plankton and algae, they actually settle on natural rocks, but they don't recognize it as foreign. And that's actually the cycle up to the fish, up to the seals, up to the whales, of course, is incredibly changed. And I'm actually very worried at the moment about these 100 to 140 million tons that are constantly being thrown into the sea on this path. And we also consume in our household every day. And we have to change something, and quickly and very quickly, because what has happened up to this point in rapid speed will continue to develop in rapid speed. It's getting tighter and tighter. And medicine doesn't have a joker that it can pull out of its pocket. And that's why I just want to give you a very small example where you could start, and maybe you would adjust the production of these things. This is a very simple bag, this little bag, just this little bag, that is called Flower Fresh Universal. And this little bag, everyone sometimes even gets 2 bags when they buy flowers. I once asked every flower seller why they were giving me this. And every flower seller answered, "I'm giving it to you so that the flowers stay fresh for a long time." And no flower seller actually knows what's in here. And just this little bag is torn open, is put in flower water, and they believe, and they think, that this is good for their flowers. And whoever loves what he does, he thinks a little further. Because I would like it if a flower seller told me, "Please, these tulips need little water. And if you want to change their situation, then just wrap them in damp paper at night and put them back in fresh water. You will see, the flower will straighten up again. When you bring these flowers home, remember that the flowers also need fresh water every 2 days. You don't have to tell them that when you put it in, because there is citric acid in it and sugar. And citric acid prevents the household or the pH of the water so much that microorganisms, which naturally multiply in the water, because it's life, it's flowers. They can't multiply, because this water is highly acidic because of the citric acid and also sugar. You can also eliminate ant cultures. When you sprinkle sugar, they are no longer able to multiply because of this amount of sugar. And that's what they do. Because now the water can stand. Now they don't have to worry anymore. Now it can stink in also. The bacteria cannot multiply in this environment. But what about my flowers? Aren't the flowers also intended to get their life out of the clear water and to make us happy? Sometimes I think to myself, I don't want to talk about the big things in the world, but I have now taken this package with me with these flowers. Otherwise, I have always asked and always argued. I would be grateful to them. They wouldn't give it to these people as flower-loving sellers. But if we don't ask for it anymore, because we are happy with the things that life needs, and so it is also for our own life, it doesn't make sense to explain the big things to you in terms of health. If the world out there no longer offers us this living space that we need for life, I don't just think of the water, I also think of the air we breathe. And my concern also applies to the plants, and to life, and to the animals that have the right to survive in this world with us. And out of this concern as a doctor for the life that is entrusted to me, the life of people, may this be just a little thought and a hint that I would like to give you at this point. And I started to tell you nutrition rules at the end of the program. And today it would be a second nutrition rule that says, how can I eat healthy? Just put everything back on the shelf that you don't know. And if you take a food out of the shelf and it says cellulose, or xanthine, or calcium propanol, or aluminum sulfate, or ethylene oxidized, just leave it alone. These are names from a big chemical kit that makes it very durable, that emulsified it, that made it attractive in color. But with healthy nutrition, or with unburdenedness for me and my body, with strength, with structure, with good content, it has nothing to do. Nutrition rule number 2, put everything back that you don't know. In this sense, I wish you all a really coming week and look forward to our next meeting in 8 or 7 days. Goodbye.